Since I was very little, I have been doing sports. I played a lot of volleyball and national folk dances, and my passion was riding sport. I was especially fit. However, by the end of 2000, I often felt very tired. Urges of going to the bathroom were sudden and harder to control. Also, very often I felt sleepy during the day. I knew something was wrong, but I thought that all the problems would go away. I never thought of going to see a doctor.
It never crossed our mind that he may have colorectal cancer, especially since we knew that it was a disease for people over 50.
If you ask me what was I thinking, well, at that point, I knew that some food was not good for me. I became very sleepy most of the time, and finally I decided to go to the doctor and to have blood tests. My iron was very low, at the level of 3, and my other parameters were not so good as well. Next thing was to ask honestly about my problem and to talk about it, and finally to make a decision to go to the bloody colonoscopy.
Now looking back, I still don't understand how for 8 to 10 months none of us ever thought that something was seriously wrong. Before colonoscopy, Milan has lost 15 kilos for 3 months.
In sharp contrast to the overall declining rates of colorectal cancer in some countries, we see that incidence rates among adults younger than age of 50 are unfortunately increasing. The key triggers factors that we recognize are poor diet, lack of regular physical activity, and obesity.
Even though the thought of that tube going through me was not so joyful, I told myself, you can manage this. If you could manage almost 2 years of chasing toilets and other natural facilities, you can manage this test. I was denying the problem for more than a year, and now I cannot believe how stupid I was.
Sedation could be used, so that minimizes the unpleasantness of colonoscopy, so there should be no excuse to avoid this procedure.
I will never forget the look on gastroenterologist's face when he came out of colonoscopy room and invited my father and me to speak with us. Milan had a tumor 10 centimeters in diameter, and he advised us to schedule the surgery as soon as possible, in a few days actually, and not to tell Milan about his diagnosis in order to protect him.
When I realized that I had a cancer, although I had been in bad shape for more than a year, I thought it was a mistake. I did not believe that it could happen to me.
After the person is diagnosed with malignant disease, various emotional reactions may appear. Immediately after hearing the diagnosis comes shock and denial and why is this happening? It can't be happening to me, this is not my life. After that usually comes fear. Fear of the unknown, then also fear of the treatment itself, fear of the pain, fear of the changed bodily image, of being dependent, being helpless, being burdened to one's family, and also fear of death. A person may feel anger and regret and guilt.
There was no history of colorectal cancer in my family. I was living a healthy life, practicing sports a lot. When I knew the diagnosis, I did not fear for myself, but for my family, for my parents, sister and my girl.
Researchers have shown that more advanced tumors are seen in adults under 50 because the cases are not being caught early enough. Screening isn't recommended until this age, and the younger the patient is, the more likely they are to ignore symptoms or more advanced stages of disease. I remember when I first met Milan, he was referred to my clinic for a colonoscopy. But why did Milan take so long to seek help when his body was giving him all the signs that something was wrong? I don't know. So I do understand that there is a fear of the procedure, especially in the men. This attitude has to be overcome, as this short diagnostic test, which at most is uncomfortable, could save your life. Colorectal cancer is highly treatable if diagnosed early. Embarrassment or fear of colonoscopy or surgery should not delay diagnosis.
When I think about the fact that my brother had colorectal cancer, first thing that comes to my mind is that it never happened. The picture of this tall, healthy, young man, it's incompatible with this terrible disease.
Cancer diagnosis requires profound changes in a person's lifestyle and also adaptation to new life circumstances, which is not easy. Psychosocial support is crucial to every cancer patient, especially to young adults. Family support and the support of the peer group in the first place. And though during the treatment we are usually focused on somatic issues, we should not forget that scientific studies show that psychosocial support, optimism and faith are at least very important elements of recovery.
After surgery, I had to go through the adjuvant chemotherapy in order to prevent cancer from coming back. I was lucky enough that I took it orally and I did not have to go so often to the hospital. I could continue with my life. I took it for 6 cycles. The only problem that I had was that my skin was peeling from my palms. That was unpleasant, but still I could deal with it.
During treatment, various emotional reactions are common. In the first place, fear and anxiety, but also some other conditions may appear, such as irritability, depression, sleep deprivation, eating disorders, etc. And person usually withdraws from everyday life, which is partly because of the constraints of the illness itself and of the treatment, but on the other hand, it is also manifestation and the consequence of deep psychological distress the person is experiencing, because being diagnosed as cancer patient is a very stressful, even traumatic experience. And this situation is actually especially severe when it comes to young adults, because they're supposed to be in their primes, strong, healthy, independent, efficient, undefeatable, and all of a sudden they have to deal with a very serious illness. And that is the reason why they are at higher risk of various maladaptive behaviors and reactions, including complete denial of the illness.
When I look back now, it wasn't so terrible. There are definitely some scars, but the hell with the scars, I'm back to my life, playing volleyball, riding horses, judging dressage and doing everything else that I have done before. After I recovered, I had enough time to think all about it. And I asked myself, what kind of an idiot could make all these kind of excuses when my body was giving me so many strong warnings? Me. I'm one of those. My cancer changed me in a way that made me stronger. Unlike the majority of people, I see the bright, optimistic side of the problems and challenges in life. And that helps me to overcome them more easily. I had one great victory in my life. I beat my cancer. Denial and excuses won't scare the problem away. You must understand, I was very lucky to have survived such an experience and to learn from it. Just 1 year after the surgery, I was jumping on the volleyball net and back in the saddle, back to my life that I had before. This is such a short time comparing to the life which I hope I have in front of me. If you feel alone, frightened or need some help, join us on our forum. It is possible to survive cancer.